Hello, hello. Laura Hooper here. And thank you for joining me for practical implementation and patient communication. Now, there's lots of ways, many ways to communicate with our patients. I'm just going to give you a few examples, one ways that have worked for me many times with my patients in the chair. In fact, probably the number one thing that I get asked is, what do you do when a patient says, I just want a cleaning? Well, my biggest takeaway is meet them where they are. Okay, it's okay. We want to let that patient know when you're ready, I'm here. That's what I want to tell them. And how can I help them in the meantime? But we still want to love on them and educate them why they're in the chair with us and let them know because a lot of times they're not making that decision, right, based on good, crucial information. And so we want to give them some time to be able to process that. So some of my takeaways, and you can use these or combine them for your own, is let's just look at this one. I say, I completely understand. You came in today expecting to get your usual cleaning, and I absolutely can do that for you today, just like we've always done. However, I want you to really consider testing because you have a silent infection. You have an infection not only in the tissue, but in the bone. And so by me just cleaning your teeth, it's kind of like just painting the outside of the house while you have termites eating away at it structurally. And by time those termites destroy your house, it's almost too late. The same thing can happen in your mouth. By time they destroy so much bone, it can be too late. So I really want you to think about how to move forward. I'll get you cleaned up today, but let's consider bringing you back and getting that infection cleaned out. Another thing that you can say is, I want to share some important information about your specific type of infection. This infection hides below the gum line. It's actually in the tissue and in the bone. Many times you do not feel that until it's a very advanced infection, or what we say almost too late of an infection to treat. If we leave this untreated as it is right now, it can quietly affect your bone, your health, and even enter your bloodstream without you even knowing. We call this type of infection an oral systemic infection. It has some of the highest correlations to heart disease, to dementia, and Alzheimer's, even to some cancers. So I just want to share some information with you. I'll give you that information to read and follow up on so you can understand what an oral systemic infection is and what the next best steps. And if you're wondering that already, for you to make the best decision, the first place that we would start is after your cleaning today, we would get you scheduled to do a test and we would find out what's causing the infection and how aggressive it is so you know how worried to be. Okay, some other things that we might talk about if somebody says that is tell them, no problem. Yes, I was planning on cleaning your teeth today. Because this type of infection requires you to come back for that specific procedure. And I want to make sure that I'm giving you that quality time and doing a really good job to get the infection cleaned out underneath. That's why today the best solution would be to start treatment with a simple saliva test. Let's find out what's causing the infection, how aggressive it is, and in many cases, to find out if we actually need an antibiotic or not, because I want to make sure that we're treating you the right way and not guessing. All right, what's another version? What if they're like, no, I don't want to come back? Some of the things you can just say, well, one of the best solutions is to not guess on these infections because they are very silent infections like high blood pressure, high cholesterol. They almost go unnoticed until it gets so bad. So, the best way is to not waste your valuable time and money on guessing. In fact, with oral infections, they never get any less aggressive or less expensive. So let's do the test and find out how worried we need to be. Another thing is you could say, unfortunately, these infections are silent. We don't feel them until we have a very aggressive advanced state. And so let's start by getting a test and finding out how worried we need to be. So there's lots of versions. You can combine these, you can add these, you can put the words you like. A lot of times I like to go back to putting in the problem. You have an infection in the tissue and bone and the consequence of not treating it. So let's find out with a simple test how worried we need to be and what is the best treatment for you specifically. The other thing is if they say, no, I can't even do the test, remember the worst case scenario is they're going to schedule for their 6 months. You're going to get to educate them again. That's the worst case scenario. But many times I'll say, you know what? If today doesn't feel right, there's no pressure. That's completely okay. You can actually take a test home with you and do it out of the comfort of your own home, or you can walk in anytime during your convenience that's easy for you and do the test. We're always here and able to do that test. The only reason I'm asking you now is that we need to wait that 15 minutes, right? If I do have you, have your cleaning or any work that we done today. So we're here for you whenever you're ready. We're here. It's no pressure. We just want to support you the best way we can. And then many times I'll just ask them, what is the best way that I can help you today? Because you'd be shocked that a patient may say, you know what, you've been talking about that rinse or you're talking about those probiotics. Many times, give the patient the opportunity to tell you how they can help, how you can help them. You just have to ask. Many of us just get quiet and we don't actually ask, how can I best help you today? That simple question can completely change an appointment. All right, let's move into scheduling the patient workflows. And again, there's lots of ways. I'm just going to give you one of my main snapshots. I have lots of different implementations depending on the practice, but here's a great way in general practice to think about your visits in 4 visits. At the first visit, this is our assessments. These are our diagnostics, right? We're going to take our radiographs. We might be doing our sleep screen. We're doing our IOPs. Those are our intraoral photos. We're going to do our scan, our perio chart, right? And at that perio chart, we're going to present the test. We're going to ask for the test because that is part of the assessment. We need to screen for oral infection. We're going to present then the treatment. They need to come back and we're going to do the prophy, right? Because we want to get that test result back. And that's where then we have a consult. And this can be either done separately or can be done at the treatment visit. So if you propose gingival treatment or you propose scaling a root plane, then that visit you can go over that treatment. And so you're going to complete your therapy, you're going to dispense the products, and then you'll schedule your next post test. And so that's the third visit. Then post testing. If you didn't do antibiotics, it's easy. It's going to be, third visit right before your 90 days, your perio maintenance. If you did do antibiotics, I really am going to pressure you to consider testing at 15 days. Make sure we broke up that biofilm and the patient took their antibiotics. That's probably the 2 most biggest failures that we see on the front end. And if you can capture that or close that gap, you're going to be much more successful down the road. All right, if you did that 15-day post-test or you're at the 90-day post-test, you're going to review that post-test at that perio maintenance, right, which is our 4th visit, our perio maintenance visit, and we're going to get them then on those maintenance products. Of course, if they're not doing well, then we would reevaluate and look for those areas, whether we need to retreat, refer, wherever that patient is. But if you're following our success program with the red and orange complex and implant complex protocols, you're going to find a very high success rate and that many of your patients will move into true perio maintenance. So how do we deliver this? I love folder systems. Yes, you can put a folder in your desktop on your email, right? And you can send that to a patient or you can make a physical folder. And I like to put in there the test results, any type of systemic connection or education for the patient. And then usually their treatment sheet or home care guide are really important. So that's what you're seeing here. I'm going to put that test in there. I'm going to put just understanding why oral is systemic so that they can make the connection. I even will highlight many times from their medical history, like if they have heart disease, so they can see if they have those specific bacteria that are connected to that risk. The other thing is putting in your treatment so the patient understands and you can talk them through it. So if they have questions, it's very interactive, but it also has their home care on there. So they're very clear what those next steps are and what products they're using and how to use them. Then I always like to throw in, something from the American Heart Association or something, that is connected, but that's completely up to you. That's just a little bonus if you're really into educating about whole health or complete health through the oral systemic connection. Again, I'm always honored to be here with you and just follow you on your journey. I want to empower all of you to create these 6 protocols for success. Give your patients the health they deserve. And remember, we're here to support you. You have lots of resources. You can always find me at salivahacker.com and IDM Scholars Society. You also have your sales representatives who know this information and can be very helpful in looking at the products and putting them into the protocols or getting you set up to start these protocols first thing on Monday morning because it's that easy. And they're there for that clinical support. So remember that you have live learning through Stella Life. You have their ebook, which is great to know where to put those products. And they have tons of education and research links for you. And of course, if you have a specific question for me, you can always reach me at my email. Thank you. And I look forward to meeting you and you becoming a saliva hacker with the rest of us on this mission to truly, truly not only save teeth, but save lives.